Welcome! In this explainer, we are going to take a clear, scientific look at the hymen. We're going to break down the biology to really understand what it is, what it isn't, and, why any of that even matters. So let's just start with the big question we're tackling today. We're going to try and separate the biological facts from all the cultural fiction to get to the real story of this particular piece of human anatomy. All right, let's dive right into Anatomy 101. Because to really understand all the myths, we first have to get the science right. So here it is, the precise definition. The hymen is a thin membrane of mucosal tissue. A good way to think of it is as the border marking where the external parts end and the internal vaginal canal begins. It's actually a remnant of fetal development, something that forms around the 5th month of pregnancy. Okay, so what is this tissue actually made of? Well, it's elastic and rich in collagen, but here are the two most important takeaways. It's vascularized and innervated. Now, that's just the scientific way of saying it has blood vessels and it has nerves. And that's exactly why it can sometimes bleed or cause pain when it tears. Though, and this is key, how much really varies hugely from person to person. Next up, it's so important to understand that this tissue isn't static. It's not just one single, unchanging thing. Actually, it changes pretty dramatically throughout a person's life. And the main thing driving that change? Hormones. And this timeline just illustrates that journey perfectly. At birth, it's actually pretty thick because of maternal hormones. Then, during childhood, it thins out. But then puberty hits, and rising estrogen makes it thicker, and a whole lot more elastic, which is what often allows it to just stretch instead of tear. And finally, after menopause, when estrogen levels drop, it becomes thinner again. Its appearance is completely dependent on estrogen. So this brings us to one of the most critical points of this entire explainer. There is no single normal type of hymen. When we're talking about this piece of anatomy, diversity is the rule, not the exception. This quote from our source material really just says it all, doesn't it? The idea of a single, standard, intact appearance is frankly a myth. The biological reality is that hymens come in a huge variety of shapes and sizes. Let's actually look at some of these variations. The most common type is what's called the annular or circular hymen. It's got a donut-like shape with an opening right in the middle, which, allows for menstrual flow and tampon use. This is probably what many people might picture as the typical shape. Next up is the crescentic hymen. And just like the name suggests, it's shaped like a crescent moon. Tissue usually covers the bottom part of the vaginal opening, leaving the top part open. This is also super common and a totally normal variation. And this slide shows a few other healthy variants. A cribriform hymen has lots of tiny holes, kind of like a sieve. A septate hymen has a band of tissue running down the middle, making 2 openings. And a fimbriated hymen has these little fringe-like edges. All of these are just normal anatomical differences. Now, let's talk about a condition that's actually rare, an imperforate hymen, and that just means a hymen with no opening at all happens in only about 1 in 1,000 females. This is a congenital condition, and it does require medical attention. This slide gives us a really good comparison of the two main conditions that might need a doctor. On the left, an imperforate hymen completely blocks the opening. This is usually discovered at puberty because menstrual flow is physically blocked, which can cause a lot of pain. On the right, a microperforate hymen has just a tiny little opening, which can lead to similar problems, like really painful or restricted periods. So, we've covered what it is, we've covered all its different shapes, but that brings us to the biggest question of all. What does it actually do? Well, according to medical science, the answer is pretty much nothing. After birth, the hymen doesn't have any clear purpose in the body. It's considered a vestigial remnant, basically leftover tissue from how the vagina develops in the womb, a bit like our appendix. So, if it has no real function and is naturally so diverse, what does that mean for the common belief that it always breaks or tears during first-time intercourse? As this chart shows, that experience is far from universal. The data suggests it's roughly a 50-50 split. About half of people might experience some mild pain or a little bit of temporary bleeding, but for the other half, because the hymen is elastic and can just stretch, there might be no pain or bleeding at all. Okay, let's pull all this anatomy and data together and just summarize the key things to remember. So the bottom line is this. The hymen is a dynamic piece of tissue that changes with our hormones, varies dramatically from one person to the next, and is ultimately just a leftover bit from development. And for all of these reasons, its appearance is absolutely not a reliable indicator of anything about a person's life or their past experiences. And that really brings us to our final thought for you to take away. The biology is crystal clear. Variation is normal. So we'll leave you with this question to think about. If diversity is the biological rule, why do so many of us search for one single story about what the hymen is supposed to mean?